My name is Dana Mathis, and today I will be discussing with you the national opioid crisis. The objectives of my presentation are as follows. Number one, after this presentation, I would like 90% of the audience to be able to state 3 signs and symptoms of opioid abuse. 95% of the audience be able to state 5 ways to determine if a coworker is impaired with opioids. 95% of the audience will be able to discuss how the opioid crisis affects hospitals financially, and 90% of the audience will be able to identify ways your organization can combat this threat to health. So let's start with the national opioid crisis defined. It is defined as the misuse of and addiction to opioids, including prescription pain medications, heroin, synthetic opioids, and it is a serious national crisis that affects public health as well as social and economic welfare. Here are some shocking statistics that I really learned a lot from. From 1999 to 2017, more than 700,000 people have died from a drug overdose. Around 68% of the more than 70,000 drug overdose deaths in 2017 were in part to opioids. In 2017, the number of overdose deaths involving opioids was 6 times higher than in 1999. On average, 130 Americans die every day from an opioid overdose. So I listed some signs and symptoms of opioid abuse so you guys can be aware of some of those. Just to name a few are mixing with different groups of people or changing friends. They're starting to hang out with people that they did not before. They're spending a lot of time alone. They're avoiding their family and friends. They lose interest in their activities that they once were interested in. Their hygiene habits change, no bathing, changing clothes, or brushing their teeth. Very tired, very sad all the time, seem depressed. Eat more than usual or less than usual. Their diet habits change. Some become overly energetic, talk fast, and say things that don't make sense. Some more symptoms are being very nervous, cranky, change in mood, sleeping at odd hours. They miss important appointments, get into trouble with the law, attend work or school on an erratic schedule, and they also experience financial problems. Now, this is how to recognize an impaired coworker, which happens frequently in hospitals. And these are just some of the signs and symptoms that you guys need to watch out for. Calling in without notification, like unexcused absences, things like that. Frequent disappearances from the work site, like if you're frequently having to wonder, where is this coworker, things like that. Long, unexplained absences, taking frequent or long trips to the bathroom or the stock room where drugs are kept. Like most of the time when you're looking for them, you find them in the medication rooms and that sort of thing. Excessive amounts of time spent near a drug supply. They also volunteer for extra shifts quite frequently. That should be a red flag to you when people are constantly wanting to work excessive shifts. Also, another one is increasing isolation from coworkers. They rarely accept blame for anything that they do. They always seem to find an excuse why they couldn't get this done or why they made this mistake. Heavy wastage of drugs, inappropriate prescriptions for large narcotic doses. They insist on personal administration of injected narcotics to patients. They don't ever allow anyone else to give their medicine for them, as we frequently do. If we get busy, somebody else may get the medicine for your patient. Also a decline in their personal appearance and hygiene. They have problems with keeping appointments and meeting deadlines. It just seems like they're constantly having to be stayed on about, don't forget to turn this in, don't forget you do this and that. Their work performance alternates between periods of high and low performance, and they suffer from mistakes made due to inattention, poor judgment, and bad decisions. They get confused, they can't remember anything, they have difficulty concentrating on, tasks that should generally be easy to most people. And a lot of their tasks take a lot more time. If you're wondering if this opioid crisis affects hospitals financially, it does. HCAP scoring, which is Hospital Consumer Assessment of Healthcare Providers and Systems, is a survey that is sent to patients once they're discharged, asking multiple questions about how their hospital stay was, multiple categories. And one of the questions is actually related to pain. So most of the nurses, staff, physicians feel like, we've got to give pain medicine because we want the HCAP scores to be good, and we don't want them to rate us as not, taking care of their pain when they needed us to. So there's a lot of pressure to make sure that we are taking care of their pain, and the first line is generally medication. But if the scores are not where they should be, then Medicare may not pay for services that are rendered for their stay. Next, I want to discuss with you how our facility is combating this threat to health. First thing is that we've increased our use of protocols. For instance, our sickle cell protocol, these patients only get a certain amount of drugs for a certain amount of time. So that's helped tremendously with the admissions that we've gotten just for pain medication only. Use of standardized assessment tools for pain to determine if pain is acute or chronic in nature, because a lot of the emergency room physicians don't realize, this patient's chronic pain, and they just feel like they need to treat their pain and discharge them. And you need to find out, is this, their pain scale may be a 4, where it lives at a 4, other people may want it to be a 0. So we're focusing in more on that. Utilization of medication reconciliation to determine opioid use at home, which helps to alert the providers of possible abuse or misuse. Use of alternative medications, alternative therapies to medication, like instead of using opioids, you can use ibuprofen, Motrin, steroids, and things like that, instead of going straight to opioids. Also, we utilize here the 3 to 5 day prescription for opioids in the ED. They're really getting away from using the 30-day scrubs. And also, one other thing that we're doing here is the use of the prescription drug monitoring program in the ED. That's something they're required to do here, and that's helped a good bit. Any questions? Okay.
Thank you. That was
Thank
very
you very much.
informative.